ice-cold therapy is coming with a red-hot warning after a young person died.
It's called cryotherapy and is marketed as a treatment for burning calories and reducing pain. The deep freeze treatment is increasingly used by athletes and celebrities. Dr. Devi is here. She's a clinical associate professor at NYU School of Medicine. Thanks for being here.
Nice to see you.
So what exactly is cryotherapy? How does this work?
Well, cryotherapy, it means cold therapy, literally, but there are two different definitions that people use. So in medicine, we use cryotherapy, and what we're talking about is really something very small and focal. So for example, like a probe that's frozen at the end, and where you might, freeze a cancer or freeze something else that's dangerous. Now, cryotherapy, the general term, is what we're talking about with these cryo chambers, right? Where as opposed to a doctor putting a probe in you, you're actually stepping into a chamber that's, anywhere between minus 200 and minus 240 degrees Fahrenheit.
I know we have some pictures of it there. So there is an example of what that looks like. You actually are physically surrounded from the neck down. It looks like, well, the woman who died, what happened to her? What do we know about that?
Well, ultimately, she probably died because her body cooled down too much. So the normal body temperature is 98.6, and we actually don't have a very wide range around that. So if the body temperature drops even a few degrees, you start to have serious problems, even with blood flow to your brain, right? So for her, ultimately, her body temperature dropped too much, and she couldn't get that blood flow to her organs, and she did die. But I'm not sure exactly what happened in between, like why she didn't step out of the chamber. I mean, perhaps, her brain had already started shutting down.
Dr. Devi, do doctors agree with any of the potential benefits that they talk about?
Well, it's really very shady because the thing is, in terms of cryotherapy for freezing cancers or freezing lesions, yeah, there are a lot of doctors who support that and support the idea of research into that area. But stepping into something where your whole body suddenly gets cooled down, I mean, most doctors warn patients, right? Don't go out into these cold temperatures. Make sure you have enough heat, stay warm, wear your mittens and keep your nose warm. So the idea of trying to cool your whole body down, I mean, it's a little bit more, I think people are more skeptical. But the reason that this is allowed to or these companies are allowed to advertise their health benefits is because they say that they're not advertising the health benefits, but their clients are. So instead of the company coming out and saying something, maybe the people who have had it done say that they felt really invigorated or they felt rejuvenated, which actually makes sense because if your body's cooled down and you're not getting much blood flow to your brain and you suddenly step out and suddenly you do feel a rush. You would feel like suddenly you're getting new life.